Welcome to the podcast, Motherhood Decoded, presented by the Louisville Mom Collective.
Hello, Louisville moms. We have a very special guest with us today, Dr. Josh Honaker. He is a board-certified pediatrician. He started his own practice over 20 years ago here in Louisville, Oldham County Pediatrics. It's a premier pediatrician's office. You've probably heard of them. He also went on to be the chief of pediatrics at the University of Louisville. Then he went into the corporate world as chief medical administrative officer at Norton Medical Group, then left the corporate world to create a new platform to support pediatricians and parents like us. It is called ParentMD. And Dr. Josh, we are so happy to have you. Thanks for being with us.
Oh, thanks for having me.
Yes. So do you want to tell us a little bit about what ParentMD is?
Yeah, thank you for bringing me to the show and allowing me this opportunity to share. ParentMD, first of all, is very near and dear to my heart as a pediatrician and a parent. It simply put, it's a web-based platform that brings three buckets of resources to parents and pediatricians. First of all, telehealth services. Second of all, education, content. And then thirdly, community. In the telehealth piece, we have gone and found some of the best telehealth partners around the country. We have partnered with Blueberry Pediatrics, which has 24/7 board-certified pediatric access. They are phenomenal. No matter how big your family is or what's going on, they can take care of you with virtual telehealth visits. We also have a group called Anytime Pediatrics that's provided after-hours pediatric nurses. This was started by a very passionate pair of pediatric ER nurses in South Carolina. They love talking to moms. They want to do this home. They have a great bench of nurses with them. And then partner with something that's pretty novel and new down in Atlanta, a group called Hearts Connected. They have a group of virtual child life specialists. So they can provide a lot of parent coaching, a lot of emotional behavioral health support for parents for a lot of the small things that come along daily that causes honestly a lot of anxiety and grief for kids and parents. So they've been awesome. So these three telehealth partners we have, then we have a software called Symptom Checker software that you can help with diagnosis and your differential diagnosis and management, what to do next. So our vision is to continue adding telehealth partners. Our job isn't to create these telehealth arrangements and get the doctors, but it's our job to vet and find the best and bring them and package them on the platform for ParentMD. And I like that to be what the brand is known for, is identifying great resources, bringing them one place for parents, and they got an easy button. Second of all is education content. So we have, there's a lot of education content around the country. So we don't have to recreate all of it. So we want to find great content, vet it again by parents and pediatricians, bring it to one site. But honestly, what we don't find that we think is good enough or something we want to add, we have our own studio. We have a podcast studio, and I have a studio for filming content with experts. We've already brought a lot of national leading experts around the country to come and talk a lot about a lot of topics. So between those activities, we want to meet educational needs again in one place that you come to, hit one button, and you can trust it because from experts and other pediatricians, parents. And then thirdly, the community piece. We want a place that parents and pediatricians can come together, share, crowdsource resources. My wife came up with the idea of this parent-to-parent resources tab where as she finds support groups, hotlines, articles, books, websites, apps, articles, things for other parents. And my vision is that parents will help us be organic and crowdsource and say, hey, share this. We'll vet it, make sure it's something we want to share, put it there, and then obviously have spaces communities can get together, and in the future webinars and conferences as well to meet one-on-one and in person. So I gave a lot more than a nutshell, but that's in a big picture. And, the passion is really to fill a gap that I think parents find when they don't always get enough time with their doctor. I never got to spend enough time with my patients. I don't think any pediatrician gets to. And then when you go leave your medical home, you honestly go to the internet. And when you go to the internet, you find all kinds of stuff, a lot of good stuff. But you have to work through it. And I'll be honest, it's not all, vetted and produced by pediatricians. So we just want to provide another opportunity and deliver it in a different way.
Yeah, I am sure I can attest for me and many other moms that you can't get a hold of a pediatrician, or there's some weird bite or rash or like something, and you just go down that rabbit hole on the internet, before you know it, like your kid's going to die, in 5 minutes. So it's nice to know that there's a resource that you're helping develop with those trusted the trusted people that you've been putting together and those resources to give us some added support. Because you're right, like in any type of doctor's office, but especially with pediatricians, like it's just like you're in, you're out. The doctors are busy. I know over a pandemic, like the whole healthcare industry has just taken a huge hit. And, it's really hard for a lot of these offices to keep up. So I'm really grateful that you are taking all of your very extensive leadership and knowledge and expertise and trying to create a platform for us to feel more supported. It's a really cool thing.
Well, I appreciate, the one of the comments I always want to make in this part of the conversation is this is not to replace the medical home.
Right.
I'm a very strong advocate of the medical home. I play a lot of leadership roles with the AAP in Kentucky, the American Academy of Pediatrics, and my colleagues. I want them to see me as a partner and a resource, and I hope it's something that they will want to reference and refer to their patients because they see adjunct and supplement for their world. Just the truth of the matter is there's so much complexity in healthcare today, and there's limited time when you have 25 to 30 patients a day. And I want us to be another resource. The other observation that brought me to this is when I started having this idea about 2 to 3 years ago, I asked some parents and pediatricians, I said, where are you going for your resources on the internet? Because myself being in the corporate world the last 10 years, and in leadership the last 15, I was out of that space of being at the bedside. But I thought I knew the answer, but I asked the question anyway. Well, pediatricians and parents all go to multiple different sites. There's not one site that's that place. Now, I'll say healthychildren.org by the American Academy of Pediatrics is a good one. It brings some resources for parents. But, I envision why not have a place with a membership model that had one button, a wow factor you felt like is vetted, trusted, partnered, and it had telehealth, had the clinical, and it had education, and it had community all in one. Because it seemed like the more I interview and talk to people, everybody kind of wanted and needed one place for all of that.
Yeah. And I love that you're not just focusing on like any physical issues that parents might be trying to address with their children, but also the social, the emotional. I have about to be a 13-year-old, and then lots of other friends with varying ages of kids, but the pandemic has all affected them in very different ways. My daughter even asked us last year if she could see a therapist. Like she prompted that just to try and work through just all this stuff that's so new. So I love that you have partners and resources to help with that side of things as well.
Yeah, I appreciate you saying that. That would highlight a couple things I really want parents to know. One, when I also did my research, because being a business person, I do my research before I step into things. I want to make sure I'm not being duplicative or redundant about what's already out there. And I want to actually promote and partner with all the things that are really good. There's a lot of good stuff out there. But what I found is most things were geared to new moms with babies, which classically that's a whole lot of the pediatric need. But as a father, I'm very passionate about the father side. As a father of two boys who are now 25 and 22, I'm very passionate about the adolescent and young adults. I'm very passionate about the emotional and well-being, of those kids as they go through the teenage years and the high school and college years. I think those are the hardest challenge. My wife and I always said, and I've got an awesome wife, Michelle, who's been my partner on this whole journey and helped me with ParentMD also, and keeps me grounded and gives me the perspective I need. But she highlights all the time that it's hard being a mother when your child is small. But some of the biggest challenges that come is when your kid is bigger and you can't be in control. And so honestly, I want to spend a lot of time focusing, supporting that. I have another big passion around kids getting outside and nature deficit disorder. So you're going to hear me focus on that a lot because it's a real passion. Also, two areas because of a couple of our key partners we brought to the table who are national and world leading experts in their areas. Dr. Gupta, who's a world leading authority on pediatric food allergies from Northwestern. She and I were classmates in medical school. Both of our children have a peanut allergy, and watching her do what she's done on the world stage, I brought her to the studio, and we've done a lot of food allergies. So food allergies will be a big area of focus for us because of our passions and areas I think parents need. And then the other one is Dr. Stephanie Eakin, who's triple boarded, and she worked at Oldham County as one of her first jobs as a psychiatrist. one day a week, but she's a pediatrician, child psychiatrist, adult psychiatrist, and her passions for around the area of adolescent females and eating disorders and issues, anxiety there, it's been big. So we brought her to the studio. But, having unique partnerships like that around the country with national leading experts, that's what I want to continue bringing the studio. So don't think that this is just a local flavor pediatrician giving their thought. This is about a brand that wants to be national and international, have a finger on the pulse of what's going on, not just in Kentucky, but the nation, connect with the leading experts, and then be guided, though, by what parents want and need. So this isn't also about what some arrogant physicians, we tend to be full of ourselves thinking we know the answer, but we don't know what's best for your child. We just want to be here as a partner on that journey to help bring resources, be a partner, as I think all good pediatricians do in the medical home. And we want to do that, though, on a national level to help people via the internet. We want to be your virtual pediatric health care partner.
Yeah, that was actually what I was going to ask you next. Is even though you are local and here in the Kentuckiana area, I was just going to ask about your vision for how this would grow, grow nationally. You mentioned internationally, so yeah, do you want to tell us a little bit more about your vision for that?
Yeah, so my vision is that we are the preferred partner and resource that parents go to someday, the one brand that you go to get it all. And that's boil in the ocean. I get that. But I think big and I dream big. I don't always hit my goals and dreams, but I'm going to go for it. I want ParentMD to be a household brand that parents and doctors, whenever they're like, well, you need to go to the internet for this part of pediatrics, I want the next thing to come out of their mouth to be ParentMD, because they have confidence and it brings it, and it's easy. There's a little friction, and they feel like it brings value. So ultimately, I'm not wanting people just to sign up for memberships and they have access to some things. I want them to have the wow factor. I want them to think it's awesome. I want them to share it with everybody. I want them to be able to share stories and testimonies with us that it changed their lives. It impacted them positively. So I can tell you about my team that works with me. We talk a lot about impacting lives and purpose. So this is not just a business venture. This is about impacting lives and carrying forward what's always been my mission in pediatrics, just in a different realm. A lot of people used to ask me all the time, they still do you miss seeing patients, and why did you leave seeing patients one-on-one? Well, I always miss leaving patients. I never thought I was going to do what I do, but after starting the practice with a couple colleagues, that opened up doors of leadership, and I just got invited to some really neat spaces that I'd like to think that through my career, I had a hand maybe on impacting bigger populations through some of those business and leadership activities. And then so for me, at this last part of my career, being an entrepreneur, I felt like ParentMD could be a platform to impact even more people on a bigger way, and just by simply bringing good people and good resources into one site using the internet and its power. And there's a lot of things doing that in the healthcare field. I just didn't feel like it had been done the way it could be in pediatrics, and I just want to partner with all those who want to do the same for parents and pediatricians.
Yeah, it's awesome. And I know you mentioned earlier how in talking to parents, like there's not one answer for where they go to find information online. And when you were saying that, I was thinking, I'm like, what are all the different places that I've looked up or looked at? And, you think of like general stuff like WebMD, but then like ParentMD, like having something that's like, oh, this is actually for parents in, that extra pediatric support is brilliant, I think.
We came across it. One of my colleagues, Amy Harrison, came up with the idea. She came to me one day. She said, "You've been trying to think of a name for this." She goes, "I've got it." She said, ParentMD. And I was like, oh my, that is too simple, too great, too awesome. So I give her I wish I could take credit of it, but the name really says it all. It shows the partnership between a parent and an MD for a parent, which is a pediatrician, right? It shows the partnership. It shows that we're working in tandem. One is not guidant more than the other. One is dependent on the other. And that's why we kept it the name, the logo. We didn't have some fancy brand stamp. We just said that says it all. So yeah, we wanted to show that partnership, and I want to be true to that. And hence, to help support that, we have a parent advisory council of 15 families. We have a clinical advisory council of 12 individuals. And And we also have a business advisory council to make sure we're good fiscal stewards and we grow a business in an appropriate way. So I'm all about, one thing I learned in leadership a long time ago is I don't have the answers. I don't know how to do everything. So what I need to do is find the best people to put around me. And I have two phenomenal executive owner investors who are working partners, Scott Diamond and Kyle Dozeman, who have a great background in business. And then we have hired a full-time chief marketing officer, Alex Seibert. So she's a young mother, very passionate about the brand. We felt like she was a great fit. And with that team and multiple other folks around us, I'm confident we'll take this and grow ParentMD to impact lives.
Yes. So kind of in that line, do you want to talk about the memberships?
Yeah, that'd be
Side
great.
of it? Yeah.
So when we started this, the big question was, okay, I had a vision of what I wanted to bring and maybe how to bring it with input and feedback, but how do you do a business transaction to exchange value? And I'm always intrigued by that because you want it not to feel too business, you want it to be personal, but there has to be a business transaction. And also we had a whole lot, so we thought we need to package in one place, and the word membership kept coming up. So we have monthly and annual memberships, and we try to start with one tier to keep it simple, but we knew we needed different price points and different packages because people have different needs for their families. The first thing I want folks to know is that our memberships are for your family no matter how big they are. So that was one of our arrangements. We went and licensed these activities and tele services from the providers. Was that this isn't about one patient, this is for the whole family, and I need it to be unlimited. I needed it simple and powerful for families. So we got that. So it's unlimited, and it's also no matter how many kids your family has. So very cost effective. The memberships at the high end is the premium membership. It has everything. It has the doctor I mentioned, the nurse, the child life specialist. We also just decided to roll in all of our video courses that we're creating with the experts I told you I bring to the studio, or national experts. We have 16 right now, but next year I think we'll have 50, and then I want to have 100 plus. I want to have video courses with national experts in here, giving everything over 2 hours that parents would like to hear in the 10, 15 minutes with a doctor, but they can't, and they're getting it from national experts. So those video courses are in there, along with all the things I had mentioned. And we've got newborn toddler survival guides. We're getting ready to start writing a teenager parent survival guide, because I want to focus on that. We've got a whole lot of things, and a lot more is coming. You can find on the website at parentmd.com. But that's the highest level membership, and that's $29.99 per month if you pay the annual all at once, essentially. And then the next level doesn't have the doctor. So for those that are more price sensitive but would like to have access to the nurse and the child life specialist and everything else, that's $14.99 a month if you pay for it annually, which is a great deal. And some people have wanted that. And nurses can take care of so much, that the doctors can as well. So they're a great resource. And then if you don't want or need the nurse and doctor, but you want the education, the community content, then you can pay $7.99 a month. If you pay annually at that annual rate. So that's how we have it broken up right now. And some things we will provide discounted or one-off sales to people who are not members. So you can buy the video courses right now, and there's individual prices for those. And later on, we'll have webinars, web conferences. And if you're a member, you get those at discount, or you get them free. And if you're not, you can still access some of those. But we're wanting to share podcasts for free to the public, which we have multiple right now. You can go to the website and see. We have newsletters we just started monthly. You'll see a column from me and content we're sharing with members, but for now we are sharing those with the public too. And we're open to feedback. And what I want to hear are all those great ideas from mothers who live and breathe this daily, and fathers, not just mothers, but mothers and fathers. What they want, what they like, what they need, what we can do better. That's how I've grown every business I've been in, is by listening and reacting to what people want and need.
Yeah, that's awesome. And that's, very, very affordable, lots of resources. Definitely anybody that is listening to this, or if we use this in the future, watching it, make sure to comment below with feedback that you have or things that you might want to see. That'd be very, very helpful. But this is a very, very exciting platform. I'm glad that, for me personally, that it's something that's available, like getting into the teenage years now. But I know for especially moms with younger kids or dads, that they will definitely appreciate the support of this, because it really takes a village. So as much credible people in your village is always a good thing.
It does, and it does take a team. I appreciate that.
Awesome. Well, any closing thoughts that you want to leave with us for this time?
No, I appreciate you giving us the opportunity to share. We're very early in this phase. We just launched a couple months ago, so we're still in the place of getting our message and the website tweaked to resonate with the public and getting people's feedback on what they want, what they like, how they like it packaged differently. I think we're on a good path, but what I'm most excited and the message I would leave is what you see is just the start. We have so much more to come. I want to have where we are helping people connect to second opinions. I want to have more telehealth providers on the platform. So this is just the start. There's more to come.
Yay, that's so exciting. Well, I'm hoping that in the future we'll be able to have you on as a guest and share more expertise. But yeah, parentmd.com. I'm excited you guys already have lots of resource and podcasts, the newsletter of resources that parents can start tapping into right away. So wonderful. Thank you so much. So everybody, Dr. Josh Honaker, Louisville's own, and we will definitely have you on again.
Well, thank you for having me. Appreciate it.
All right. Thank you.
Thanks for joining us, and tune in for our next episode.